morning, Dr. Patino here at the Cosmetic Surgical Center of Osrito. So I'll show you what we're gonna do. This is micro air power assisted. Why is it power assisted? Look at this. See, the tip vibrates. It's electricity. It's like the toothbrush, right? Liposuction. Why? Because we're gonna suction fat. And what I want you to see, we're just starting, but I predict what's gonna come out of here is yellow. So I was seeing some consultations yesterday for a fat transfer to the buttocks, which is what we're gonna do today. And I was gonna tell them, look at the aspirate, look what comes out, okay? What comes out is yellow, and that's what's gonna go into your buttocks, yellow fat. And I'm gonna show you, this fat that's coming out is what's gonna go into her buttocks, right? You're gonna see it now coming out, and you're gonna see it later on going into her buttocks, right? But this is just incredible. She's on her side, and you can see, what color is that? But you know what? Look, how do we do this, right? I mean, many doctors even wonder, how is it that this guy can get this yellow fat now and keep it yellow and put it into the buttocks, right? And that's how we do it. There is systems that you can purify the fat when it comes out red, and you turn it kind of yellow, but it's never gonna be this yellow. No way, no way. We've seen those systems, we don't use them, and we just concentrate on doing this. Yellow to come out, yellow to go in. And so that way, you know, you're not gonna, normally you lose like 50% to 30% of the butt when you put it in. Why? Because what you put in is red. So it's not yellow, it's not fat at all. Is some fat and some blood, and obviously the blood is going to be reabsorbed and the buttocks are going to shrink, right? But here, so this is just incredible, right? And we have doctors that they don't believe it, right? So they come here and they see it. So we teach all the doctors how to do this. But the thing about it is that it's many things involved. There's no secret, but the key here is to go slow. Look how slow my strokes are. I've never seen any surgeon in my entire life go this slow. They would think, oh, this is ridiculous. But see, they don't realize that they have to spend time purifying that red fat. And we don't do that. We don't spend time purifying the fat because, yes, we go slow now, but at the end of the day, we save all the time because we don't have to purify the fat. It's already pure. And it's not going to be any purifying system. It's not going to be better than this. I can tell you that for sure. This is incredible. Look at the quality of this fat. And we're going to show you when it goes in the butt. This is exciting, you guys. And we teach all the doctors how to do this. Wow, so the river of fat just does not stop, right? But it's a combination of things. The bottom line is that we go slow. You know, if you want to do 4 or 5 patients in one day, it's not going to be for you. You're not going to be able to do this because my strokes, as you can tell, are very slow, and so that's the most important thing, really. The type of cannula also, we use smaller cannulas, and the tumescent anesthesia, you have to tumescent the tissues correctly so that there is no bleeding, and wait the appropriate amount of time. We waited how long now?
About an hour.
Before we started? About an hour? Yeah, so that's it. You have to wait an hour. That's what Dr. Klein says. The tumescent needs to detumesce, and that takes an hour. Thank you. Wow, look at the quality of that fat, Wendy.
Incredible.
It's just incredible. But also look at the strokes, you know? When I stroke my cannula, very slow, right? Hey, Wendy, it's like a bullet, right?
Right.
If you put a bullet in your hand and you just go gently like that, nothing's going to happen. But if you put it at high speed on a gun or a pistol, it's going to break your hand. It's the exact same concept. If you go slow, and of course, if it's a big bullet, it's going to beat you even more, right? It's going to hurt you more.
Right. Or like the concept of an electric toothbrush.
Yeah, and this is a small bullet. It's a small cannula. Very small, 3 millimeters only, you see? So if you want to do this very fast, you put a big cannula, you go very, very fast, and there's going to be a lot of bleeding. But we do it this way. Look at that. Incredible.
Beautiful fat.
Thank you. Beautiful fat. Wow. So look at this. You said, Gabby, she's down to what?
To the bone.
She's down to the bone. Can you see? There is absolutely no excess fat here. anywhere we go, right? Anywhere. Look at this, see? Very, very nice and very nice and regular, right? All over, no excess fat at all. You see that? Can you see that from that side? See? That's the pinch test, we call it. See, no excess fat anywhere we go. Here at the Cosmetic Surgical Center of Costa Rica. Thank you. Wow, so look at that, man. What color is that? I mean, I don't get tired of showing this beautiful yellow fat. I just don't get tired because it's just incredible to me. Huh? Look at that, the quality of that fat. And that's what's going to go into her buttocks, you know? It is just incredible, man. Huh? ¿De qué color es la gordura?
Gordura amarela?
Gordura amarela? Por que essa amarela?
Porque não tem sangue.
Ah! So, ¿cómo se dice eso en español, Gaby?
Grasa amarilla.
¿Y por qué está amarilla?
No hay sangre.
Gracias.
Okay. So doctor is right on top of the superficial gluteal fascia, which is right underneath this white line. This big, clear, straight white line, that's the cannula.
Let me wiggle it so people can see it.
See how it's kind of wiggling up and down? So you can always identify the cannula because it's the most straight white line. Yeah, right there. See? Down here we have the deep gluteal fascia, and underneath, kind of in this area, is where the muscle is, and you don't want to be putting this line near that muscle, right? So we know we're super far away from the dangerous area because this line is all the way up here and not down here.
Let me get a bolus so you can see, okay? A bolus of fat. You see? I'm giving a bolus of fat, and that area, the space is going to get bigger. You see?
Yeah.
So I'm giving the
See how it's expanding right here in this area?
Wow, so that's a very beautiful view right there. I'm gonna show you. I'm gonna wiggle the cannula. You see me wiggling right there, and I'm gonna give it a bolus. Okay. So let me get the cannula in there, and I'm gonna give it a bolus. See? You can see. Yeah, that's the cannula moving in and out, and the space filling up. Show them the space filling up with fat.
This line is coming down, this line is coming up, and the space is filling with fat.
That's incredible. As the cannula goes in and out, you see?
Alright, so we have the cannula right here. You can see how it's one straight white line. It's very easy to see. Down here we have the deep gluteal fascia, and underneath is the muscle. Up here we have the skin, and then we have the superficial gluteal fascia. So this is the area where doctor wants to be putting fat.
Let me wiggle the cannula so
Yeah,
you can
wiggling.
see the cannula wiggling, and I'm going to retrieve it and give it a bolus. You see? Give it a bolus. Incredible. Look at that space, how it's getting bigger. Show them the space that's getting bigger.
So the deep gluteal fascia, which was up here, is now further down in the image, and the superficial gluteal fascia is moving up. That's because fat is going into the space.
So look at the quality of that fat that's going in. Is just incredible, huh? Just follow that yellow, beautiful fat in there. And that's it. Thank you.